Hello, Dr. Houghton here at Ascension Chiropractic in downtown Ottawa. I just want to share a story with you about a patient that came in, a lady in her mid-40s, and she had come to our office and she was complaining of neck pain, shoulder pain, pain down her arm. It was so severe that she was tearing up. She was crying and in so much agony. And so this has been something that had been kind of growing over the last couple of weeks and just hit her. And so she'd come in, I sat down with her, I asked her some questions about the problems that she was experiencing. I did my assessment, so I checked with my hands what was going on in her spine, looking for problem areas that were causing some pressure, dysfunction in the joints and in the nerves, which I did find. And then we also took x-rays. So we took a look at her spine. So we took a full spine. I wanted to know what was going on in every part of her spine. And then we did an evaluation or a report of that. And what I was showing her were the areas in her neck that were not functioning properly, the joints that were not moving the way they're supposed to. That affects the nerves. And also, she had some structural problems in her spine. This wasn't something that just took place over the last couple of weeks. This is something that had been developing in her spine for many years. In fact, more like 25 or 30 years. And so it was a situation where it was one of these things that it's gradually all of a sudden. And so she had this thing that came on in horrible pain. So what I then said, I recommended what we needed to do. We needed to be performing chiropractic adjustments to get the joints moving again, to bring back mobility, to actually help to restore neurological function in the joints, in her spinal cord, in her brain, and also, of course, to get her out of pain. The good news is it took just a few weeks and she was noticing progressively with her adjustments that pain was subsiding, giving her relief. She's able to sleep through the night, able to work, and able to get some relief that she needed. But she also knew that she had these structural problems that needed to be addressed. And so in addition to the adjustments that I was doing to bring relief, we're also doing adjustments to also help to restore correction in addition to the homework that I was giving for that purpose. And so what you're going to see on the screen is an x-ray, her initial x-ray of her neck, the one that's on the left, which will be quite flat, very straight, putting a lot of pressure on her spinal bones and also stretching her spinal cord. On the right side, you're going to see the curve that's developed over that 6-month period of time to that point. And so we continue to do structural corrective work on here so that we were taking care of long-term problems. This wasn't going to be something that's going to be revisiting her down the road. So I'm sharing this with you because there is hope. There is hope for your neck pain, your back pain. You may never have had a proper assessment done before. And so it's current hope to be out of pain, but it's also future hope that you don't have to continue to suffer from that. And so if you live in the Ottawa area, we'd love to have you call us. We can do a thorough check on you. And if not, certainly be looking for a chiropractor in your area. But if you're here in Ottawa, give us a call. The sooner the better, because your problem is no more correctable today than it will ever be. So the sooner the better. Give us a call. We look forward to seeing you and getting to know you.